Hi, I'm Dr. Vishrut. I'm an MBBS graduate from Vydehi Hospital. I've graduated from the year 2019. So my four and a half years in Vydehi was pretty good. Coming to the infrastructure of the college, it's decent, and most of the time it is more student friendly for the MBBS graduates. You have a large library where you have a gallery of books where you can refer. Apart from that, the hospital is 2000 bedded hospital where you have various specialities, so there is a scope for learning various subjects as you pursue the MBBS. So from first year to second year, the lecturing will differ. So usually when you graduate from the second PUC to the first year, there is more of spoon feeding that is done. Teacher will usually take care of you in first year. So as you step up from the second year, the involvement of teaching from the professors keeps decreasing. So in third year, basically when you start your fourth year, you will be all upon yourself. Although the classes will be there, it's more or less a generic classes. They don't go in detail. However, they'll be available for doubts and other sessions for you. So from second year, you will be introduced to the clinicals, where you visit to the hospital, take cases of the patients regularly. The patient inflow is very important in a particular hospital. So the more the patient you get, the more you learn. Even though you repeat the cases, every time you keep learning new things about the same case when you take repeat cases. So in second year itself, you will be introduced to the hospital setup where you take cases. So there you will have regular lectures of approximately 1.5 hours to 2 hours, where the lecturer comes back to you, review your cases and give you guidance on the cases. Coming to the labs, all the subjects have, especially the first and second years, have a dedicated lab like anatomy, biochemistry, physiology. All the labs, they are well equipped, and it is sufficient enough to get good knowledge, practical knowledge doing the lab within the laboratories. Especially when I would like to tell that anatomy lab is very good. You will have enough number of cadavers to dissect and learn. So coming to third year and fourth year, usually there is no labs for third year, fourth year, because it's a clinical subject. So you will be having the case studies basically, where third year it is ENT, ophthalmology and community medicine. The setup is fine for the third year, where ENT and ophthalm is pretty good. Community medicine is a generic subject, so you will be taken to fields to learn all the community medicine based subjects. Then change in the landscape, as I said earlier, by the time you reach fourth year, the classes will become too generic, and it is not mainly theoretical. As the professors, they come, they teach. Usually the classes are for 1 hour, and there will be efficient class around for 30-35 minutes, where they give you the general idea and you have to do some work from your side to get more out of them. Then coming to the internship is for 1 year as usual, and my favorite branches in Vydehi was general medicine, general surgery, pediatrics and ortho. These four will give you sufficient amount of exposure to the patient, and you have enough number of chances even in surgery department, where you can they give exposure to the OT theaters, where you can get a hands-on experience. Apart from that, general medicine, the caseload is very good, so you can learn various cases compared to other medical colleges within Bangalore who is having private medical colleges, because the caseload based basically from the West Bengal. So you have various kinds of cases that you can study in the general medicine. Pediatrics, it is okay, decent. So nothing to be worried about that. You will touch up on all the cases, variety of cases, even in the pediatrics. Emergency medicine is good because it's an IT area. Although there are multiple corporate hospitals, you will have enough number of cases, emergency cases, that you can get exposed to. General surgery is good. Orthopedics is very good. Then apart from that, you'll also have a 1 month postings where it is divided into 15 days, where you can select the super specialty branches based on your liking. So that involves cardiothoracic surgery, cardiology, neurology, endocrine, and urology. So that depends on you, which subjects you want to choose. So you will have like 15 days mini exposure to the super specialty also. If you're more into surgical or something, you can go ahead with the super specialty branches that you are aiming to do further after MBBS. So you can get a general idea how the department works and how the caregivers usually spend their day, how their lifestyle is. So that is all. Overall, I would like to give 3 to 3.5 for my Vydehi college. It's a decent college, and you can consider it if you have a sufficient ranking and liking to the MBBS. Kindly like, share and subscribe for Medical Mentor YouTube channel as well as other social media platforms. Thank you.